Well, welcome back at 7:12. Medicare's annual enrollment period started last week. If you want to change your Medicare coverage for 2023, now is the time to do so. Dr. Brent Wallis from People's Health joins us to discuss the annual enrollment period and your Medicare plan options. Good morning. How are you?
Hey, I'm doing great. How about you?
Oh, good. Good to see you this morning. This is a really important period for really anyone. A lot of folks are starting to kind of roll over their health care, but Medicare open enrollment period is underway right now. What is that?
Yeah, so annual enrollment is a period of time every year from October 15th to December 7th, where people that are Medicare eligible can choose what coverage they want for the upcoming year. So it's a really important time of year to look at what coverage you have now, because as you age, you may need different benefits. So it's a good opportunity to kind of make sure you've got what you need for the year to come.
All right, so if you have Medicare or you are eligible, is this the one time of the year that you can make changes? Are there special times where you can make a change if something happens?
Yeah, for the most part, this is the time of year where you do that. There are a few exceptions. For example, if you're turning 65 for the first time, if you have Medicare or Medicaid, and then in certain instances where maybe you've moved to a new location. But for the most part, this is really where you need to think about your coverage.
Okay, so what types of Medicare plans are out there? Is it similar to a regular type of insurance?
Yeah, it is. Usually people start with original Medicare, but you have to keep in mind that original Medicare doesn't cover everything. For example, it doesn't cover dental visits or vision and eye exams in a lot of cases. So a lot of people elect for Medicare Advantage plans, often include some extra benefits.
So you're saying a Medicare Advantage plan that would include some of those extra benefits. I guess how do you choose really, what's right for you when you think about it? A lot of folks may, maybe you have a knee surgery that you need in the future, and your plan doesn't necessarily cover that right now. Would it be appropriate to try and get the type of coverage so that you could get that surgery or something similar to that?
Yeah, absolutely. You want to look at a couple of different things. Cost is one. What are your deductibles and your cost sharing going to be? Because if you do need a procedure, or say you need a special type of medication, a prescription drug, you want to make sure that that's covered. And another thing is the network. So if you have a doctor you've been seeing and you want to keep seeing them, make sure they're in the network for the plan that you're choosing. And then the last piece would be those additional benefits. Are you going to use a fitness membership? Are you going to use the dental, vision, hearing benefits? All of those things. If you don't need them, don't go for them. But if you do, it's a great opportunity to save some money.
All right, so now is the time. There might be some folks out there who haven't done it yet. How can they find out some more information to figure out exactly what may be right for them?
Yeah, you can always, we have a Medicare Center in Metairie right at the corner of Vets and Causeway. It's the People's Health Medicare Center. You can stop by anytime or give us a call over there and just to talk to somebody about what the options are, what the benefits could be for you, and really help you make a decision for the year. It's a great opportunity.
All right, Dr. Wallis, we appreciate you joining us this morning and giving us some more information about Medicare. The open enrollment period is happening right now, so don't miss it. We appreciate you.
All right, thanks, Rob. Have a great weekend.
Take care. You too.